you're very opinionated and vocal about how we should eat, how we should exercise, how we should do everything. You're definitely polarizing and have a stance. But why people can know you're authentic is because no one wants to listen to your advice, but you'll double down on it anyways. Yeah. You say, stop eating the excess sodium, stop eating the excess salt, eat healthy, work out, you don't cut corners.
I'm not telling people what they want to hear.
No, that's what I'm saying. So that's why I'm thinking you're trustworthy, is it really isn't what we want to hear. And it makes people mad, and you might not go viral on telling people the truth, but it is the truth. And it is funny, like even sodium recommendations, I think just this year they put out recommendations that were even lower for sodium than they have been in the past. So it really shows you this stuff that you've been preaching for 20 years. Mainstream physicians are now getting on board with more so, and I'm sure it will slowly evolve and you'll tweak and update throughout the years. But
and I'm trying to advocate low sodium diets for children and toddlers for the whole lifespan, not just because that's when you get the best effects, because your body adapts to the lower sodium intake.
Right.
And also it takes, you could say, weeks or months to adjust from a high sodium intake to what we're recommending, a low sodium intake. So it's true, temporarily a person could have feel fatigued, have a little relative hyponatremia, or have the blood pressure because their body, they're taking in less sodium and their kidneys still excreting a lot of sodium because the body had acclimated to the high sodium diet. So it takes a while for the body to hold on to sodium, to learn how to hold on to it when you got so accustomed to and habituated to a high sodium intake.
How long would that transition take? And is that kind of like a detox?
Yes, it's about a week. It takes about 1 to 6 weeks based on the individual person. So they could have temporary hyponatremia. That means low sodium intake or hypovolemia, being somewhat dehydrated from not taking in salt in their diet because they were used to such a high salt diet. And that means that some people, not most people, but some people need to reduce sodium more gradually. They can't sort of cut it out already. And there are some people with damaged ability to control sodium intake with aldosterone, control reclamation of the retention of sodium with aldosterone, and they need a little bit of extra sodium in their food. But that's about 1 in 100 people. You know what I mean? So we're talking about, so there are always exceptions to every rule, of course.
Totally. And that's where I was going to ask this, because I feel like it is relevant. You know, these tests, True Health, True Age, True Diagnostic, Function, Function Health, all these tests. Do you think it's beneficial to actually look at your testing and see are certain things are elevated and maybe it will motivate you in the kitchen?
Yeah, I'll tell you why. I would normally say no, because look, the most important thing is follow a Nutritarian diet, and follow, conservative supplement recommendations, which we know your diet may not have ideal amounts in, right? We don't need this testing to prove that. But the problem is that you and I are seeing is that most people don't want to change their diet as radically and as healthy as we eat. And it's hard to get people to listen, to want to change their diet sufficiently to fix their problems.
Yeah, like a motivation.
Right. So when you do a blood test on a person and they see numbers and reasons to see that they're, look, wow, you've got a lot of inflation.
It's affecting my liver.
Yes, if your liver is not functioning well, you show these...
You're at a high stroke risk. I don't even know if they can test for
neurologic damage is occurring to your brain. Look, you're aging faster. And look, your age is 10 years higher than your biological age, and you're about to have a heart attack or a cancer. You're close to cancer. By doing these testing on people, it gives you an extra motivational tool to convince them to make some of the changes we had wanted them to make anyway.
And then you kind of get a pat on the back if you tested and improved those numbers, and you're like, wow, that little tweak or big tweak worked.
Yeah, so sometimes it helps you motivate the patient to make the changes you want them to make. You didn't really have to spend that money on the blood test in the vast majority of cases. Of course, there's some rare cases where you find something on the blood test that you didn't know about, where some individual extra thing or extra supplement could have made a difference for the person. So we're not pushing any particularly high expensive testing, but in some cases they can be helpful.